All right, thank you. So what I'd like to bring up is Denise and Peter up to the stage. So what we're going to talk about today is something I thought was really, really exciting. So basically, these two did a wonderful and very innovative arrangement and joint venture or acquisition of bringing in home care services into a health system. And I'll let them describe all the details on it. And I have, you could take that. But first and foremost, what I'd like to do is introduce. To my left is Denise Keefe. She's with Aurora, Advocate Aurora, excuse me, and I'll let you.
Sure. So good afternoon, everybody. I'm Denise Keefe, President for Advocate's Continuing Health Division and Executive Vice President for the Health System. Been with Advocate Aurora for 29 years and had the opportunity to really build out what I will describe today, our continuum of care and continuing health.
And next to Denise is Peter Ross.
Peter Ross, CEO and co-founder of Senior Helpers. We do personal care in 44 states, Australia and Canada, about 350 locations. Thank you for having me here.
Thank you. So what we're going to do here, it's a little bit of a different format, and we're excited about it. So what we're going to do is they're going to go through a little bit of a presentation, kind of some of the process they went through, and then at the end of this, what I'll do is I'm going to ask them some questions. We spoke earlier today, and we spoke for about 45 minutes, so I do have to keep this to a half hour. There's a lot of very interesting information that they're going to go through. I may interrupt a little bit here and there just if there's something I want them to kind of expand upon. So
Absolutely.
With that, why don't we begin the presentation? Denise.
Sure. Well, I'll go ahead and kick us off. I want to give you a little bit of background about Advocate Aurora Health, and in particular, continuing health, which is where we house all of our home and community-based services. So quick overview of Advocate Aurora Health. We're an integrated health system located in Illinois and Wisconsin. We have 26 hospitals, 70,000 team members, 10,000 physicians who are both employed or aligned. We have 3 million unique patients that we serve every year, but what I'd like to call out is really that 1.3 million who are in some sort of a value-based contract, risk or value-based contract. We have been in population health and risk for more than 20 years and have been really building out our capabilities around population health along that journey. And that refers then to our comprehensive post-acute network that I'll speak a little bit more to now and talk about continuing health. So we have rebranded ourselves from post-acute to continuing health. We were very deliberate about making that change because we saw, as we were building out programs and services, that many of the patients we were caring for were really pre-acute. They weren't just post-acute. And so wanted to make sure that as we build out the programs that the health system was understanding, that our goal was to keep these patients in the community as much as possible. And so that was one of our, one of the goals of us was to really build out this platform of services that enable us to keep patients in the community. We have 20 years of experience managing capitation in post-acute or in our settings because we knew that was a capability we really needed to master as we moved more and more into population health. But for those of you who are part of a health system, or for those of you who have interacted with health systems, pretty much everybody, you know that the center of the health system typically is the hospital. And so we had a lot of work to do with our hospital leadership to make them understand that as you move into population health, it's really about turning that paradigm around and trying to keep patients out of the hospital. So one of the ways that we did that was we added up the average daily census of all of our Advocate Aurora hospitals. That average daily census is about 4,100 patients on any given day. If you add up the average daily census of all the patients we care for in continuing health, it's over 24,000 patients a day. And so when we see our job as keeping those 24,000 patients out of those 4,100 beds. And when we do that, we've done good work. And that's, I think, what has been, was probably the shocking part from our hospital health, hospital leaders early on. I think today they recognize the value of that. So let me, so with all of that as background, our goal was to really transform home and community as a platform for care delivery. And we've been about this work for over a dozen years. So, you know, as I share with you, this is what we call our continuing health acuity curve. These are all the programs and services that we have built out over the last decade or so that starts to lay out how we manage patients longitudinally for our population health work. At the core of continuing health is our home-based services, home care, hospice, home medical equipment, home infusion, under number 8. That's been our core. We own and operate those assets. But as we started getting deeper into population health and into the claims data really exposes two things: opportunities and cost savings. And so we started building out our acuity curve based on the priorities coming out of our claims data. So our next program was really looking at skilled nursing facilities and how do we manage the care in skilled nursing facilities. We did not want to own skilled nursing facilities. It was not a core competence. We just knew we had to manage the care. So we developed a care model, a nurse, an advanced practice nurse, and a physician that round in a narrow network of our skilled nursing facilities to drive results. And I'll share our results in just a couple minutes. Another program is our Advanced Care at Home program. I think we've heard a little bit about that throughout the conference, where we have essentially it's our home physician program coupled with our home palliative program to manage a very complex and multiple chronic condition patients. We become their primary care physician, and we manage them in across a longitudinal plan of care, usually up to a year, if not longer. So they are actually our quarterback, if you will, for all the rest of developing out our plans of care. That team will then pull in home care, pull in hospice, pull in advanced care as the patient's changes condition. And then I'll mention that we have our home hospital program. Again, because we were able to pull on all the talent of all these programs and services, we stood up that home hospital program in a matter of a couple of weeks and scaled it to 26 hospitals in a matter of a couple of months. So, we've been able to really take advantage of this platform we've created. However, we had one gap, and that gap was in-home personal care. And so that's where Senior Helpers has come in. As we've gotten deep into population health, we know the value of being able to help our patients and our seniors in particular stay in their homes. And Senior Helpers it will be a great addition to that work. I'll just quickly mention that we actually went down the path of acquisition with Senior Helpers. A couple of years ago, we stood up a company called Advocate Aurora Enterprises. It's a for-profit organization. It's essentially an internal private equity company where we either acquire or we invest in consumer-facing companies, and that's where Senior Helpers has come in. So I'll briefly just show some of the results from some of our programs. Advanced Care at Home, Palliative at Home, driving in excess of 40+% reductions in readmissions, 36% reduction in total cost of care. Our post-acute network skilled nursing facilities, $60 million in savings annually back to the Medicare program. And our virtual healthcare program, which I didn't talk a lot about, but we're managing really that top 2-3% virtually, along with their physicians, resulted in a 74% reduction in readmissions. So we're looking forward to building out care models with Senior Helpers that enable us to continue down this path with these kind of results. So with that, we're looking at how we bring these two organizations together now. Senior Helpers joined us in April of last year, and creating that platform and building the lifelong relationship, which is our mission for Advocate Aurora Health. How do we make sure that we can build this lifelong relationship and help people live well? Peter?
My turn?
Yep.
Awesome, thank you. So our excitement at Senior Helpers were really around this longitudinal care, this really population health look at the entire healthcare system. So a little background on Senior Helpers. People wonder, well, just Advocates is in Wisconsin and Illinois. Well, Senior Helpers is in 44 states. So it's an opportunity for Advocate to expand their horizon. But we've had great growth over a number of years, and we do have a lot of great coverage out there. We service more than 20,000 lives a day. We have some unique differentiators that make Senior Helpers, from a healthcare system perspective, we're really about data. We want to track, we want to look at data. We knew even personal care, and for years in personal care, I think we're all waking up for it now, but for years it was just not something we really concentrated on. We weren't star rated, we weren't all these things, but we do really unique things that really make us, I think, unique and also a great fit for Advocate Aurora as we looked at this partnership going forward. We also have a unique platform. It's an innovative care management program called Life Profile. We assess every single discharge, every single assessment we do based on their ability to live in what we call an autonomy score, their ability to live at home with 18 years worth of data that we've collected to really score. It's almost like a fuel gauge on whether that person can stay in the home safely and what levers we can pull and what buttons can we push to make it even better. And by using Life Profile, we've been able to get readmissions down under 3% in the markets that we've been using this for a while. That's a huge savings to the healthcare system, and that's where people want to live. And I think we all know that care is being moved into the home. So a very exciting opportunity. I think this is something you'll hear more about as we look at synergies going forward as well.
Peter.
Go for it, Bill.
Peter and Denise, just a question. You both came at it from different, obviously, you're a health system, you're PE backed. Although you have you called it AAE, Aurora, Advocate Aurora Enterprise. Talk to me a little bit about what are they going to do to measure the success? So you mentioned PE, so everybody who has PE backed, they want to, how do you quantify my investment?
Yeah.
So how are they looking at that initially when the opportunity came forth?
Yeah. So initially, we approached it just like any other investor would, where we were looking at would this investment make a financial return? And that was the approach we took. As we got deeper into the conversations, we started looking at what are those synergies that we'll be able to gain as a health system, learnings, care models, et cetera, that would really start to propel some of the work that we've been doing on the population health side. And that, all of those type of synergies, we saw that as, kind of gravy on top. Like that would be just something that we would be able to additionally bring in to the organization.
Yeah, I mean, I just looked at it from a perspective of, as this was our third transaction at Senior Helpers since I started the business, and all the other two are private equity. In fact, I was telling Bill and Denise earlier that I've done 58 management meetings for all of those who've been through acquisitions. You know what those are. One of them was a strategic, and I was hoping for strategics more often than one. And I looked at this as where it could catapult what we do at Senior Helpers. We in personal care dream about being part of a health system that we could actually leverage the resources and the data and the information that they have. And so my excitement was probably more exciting than they were looking at a return for sure. And we've been able to do that for private equity for, 10 years now. So we knew we could deliver the return, but we were doing with our team is how do we make these synergies like you see on here from a strategic priority perspective? How can we make these work? How can we solve that equation of giving really good data as we start to negotiate the managed care challenges we're all going to have? We now can have all of this longitudinal care under one roof. And that's fairly hard to do, Bill.
And just to kind of expand on, we talked a little bit about this earlier, but actually EBITDA, again, everybody wants to know what the bottom line is.
What's EBITDA mean? I don't know.
So a question I have is, did the focus shift a little bit more from like the financial of just the silo of Senior Helpers to, looking at the total spend of reducing the total spend per patient for all of Advocate Aurora? Has that shifted a little bit?
It has. I would say, if I look back at, our board's input in particular, they were very committed to, I'll go back to helping our patients live well, and in particular, looking at how do we help seniors age independently. Like that was what was at the core. But so while we went through the financial analysis, that synergy piece continued to come up from our board. Like, what are the synergies? How do we make sure these synergies work? And so where we have overlapping territories, we are looking at what are the right pilots? Where do we build new care models? And the board is as interested in hearing about that work as they are about the financial performance of the asset. So I do think, we're seeing how this all comes together for the organization.
So as you quantify that, because it always comes back to somehow you got to quantify it. You talked a lot about data. So what are you looking to what kind of data are you looking to generate, accumulate? How are you doing that to make sure that, again, what we're saying is actually happening?
Yeah, what's great for us is we track our own data. I'm a Six Sigma graduate, so we have KPIs on everything that we look at within our business. we didn't have access to, Bill, before Denise and the team came on, is access to all the claim and information on the health side, of outcome side. We can say that our readmissions are 3%, but what does that really mean? We can say that we keep people out of the ER. What does that really mean? You know, Advocate Aurora has this thing called Healthy Days. I love it. It talks about, you know, not just when they're in the hospital or when they're in the acute, post-acute setting, but what are they like before and after? You know, and I think David Beata mentioned a comment yesterday. We don't look at 90 days, we look at 365. I think that's a great comment, but what we can actually do. So we now have access to the other side, what's behind the curtain that personal care never had. We basically relied on everybody else telling us what it is. Now we think we can really stand up some really, really aggressive pilots that we can then go to the MA plans and the payers and say, oh, no, we actually do this, and this is why you need to reimburse us at this rate, because this is how much we're saving you, opposed to just getting cut.
Yeah, and you know, as I mentioned earlier, we have been in risk for a long time, and in order to be successful in risk, you have to have good data. So we're looking forward to getting the senior helpers data to come into not only our clinical data, but all of our claims data. We have an electronic health record where we'll pull all that together, and that will then help instruct us on how do we start to build out care models for patients so that they can stay in their home. And then for all the programs that I shared with you earlier, you can see we do measure total cost of care. So we bring in, if we stand up a new program, the expectation is that if it doesn't reduce total cost of care, then we're going to have to make a decision about whether or not that continues. And so the programs that we have stood up are all about being able to improve patient outcomes and reduce total cost of care. And what a great place to be. That is a win-win all the way around, because the patient experience is so much better. So I think that's what we're looking forward to, is pulling all this data together that will enable us to do some really interesting work for the good of our patients.
One of the bullets that you have here is territory growth. Obviously, Advocate Aurora has a footprint. Senior Helpers has a footprint. They're not exactly aligned. They're aligned definitely aligned in certain markets. Yeah. How are you looking to basically, to grow into those areas? What are we going to do with them? Plus, it's a franchise model. So maybe we could talk a little bit about that and some of the complexities that go along with that.
I mean, you can talk about the Advocate kind of growth opportunity, but I can talk about the franchise piece.
That would be great.
Yeah. So as I mentioned with Advocate Aurora Enterprises, the goal for Advocate Aurora Enterprises is really to stand up consumer-facing or invest in consumer-facing organizations. And so, we see Senior Helpers as an opportunity for us to be able to bring in some of those companies and start to spread those. So for example, we invested in a company called FoodSmart, which really enables clients to have access to, where they have challenges with access to food, facilitating some of that, access to dietitians, et cetera. So how do we use that investment that we've just made in FoodSmart to support Senior Helpers, patients who are in their home, wherever that is? That doesn't have to be in Illinois or Wisconsin. So we're looking at more of those type of investments, and will start to take us into other markets and support Senior Helpers as our, launch point.
Yeah, I think in addition, we're obviously a franchisor as well. Of all of our locations, we have 5 locations that are corporately owned, 2 of which are in Chicago and Milwaukee, which happens to be headquarters for Advocate and Aurora. So those synergies are awesome for us to take advantage of. But also within the territory growth on the slide, we have an opportunity out there where franchise candidates are saying, hey, you're part of Advocate Aurora, and they're a big health system here. That's a huge benefit if we're competing against another brand or something. So that gives us a leg up in those markets and expanding around the country. Advocate Aurora Enterprises is looking at technology solutions. It's looking at all these types of things that plug into this strategy. Advocate Aurora Health is in a very aggressive health system that's looking at opportunities to expand as well. So we have the opportunity to leverage, and I really look at it as access. We want to create data where we stand up these pilots that Denise and I are talking about and utilize those in all these other states. Advocates, in a syndicate with a lot of great hospital systems that Denise talks to every month. How can we look at that as an opportunity to expand, but get the word out we have really good data that we can use. So access to 10,000 physicians and 20,000 clinicians. We obviously didn't have that access at Senior Helpers. So there's so many more resources that we can look at. That's why we're just scratching the tip of the iceberg here. The real detail is what we're going to get to over the coming years, and it's just really exciting.
Great. One other question I had is, so we're 10 months in it, and I said, how's it going? But one of the questions, culturally, I mean, they're two very different cultures. How is that bringing those together? And were there any concerns? Peter, you mentioned a little bit on your side. Talk a little bit about that.
Yeah, I mean, from a private equity backed, as I'm sure a lot of us in this room are, the motivation or the interaction with the company is if your financials are hitting correctly, they're not really getting involved in the operation of the business. When you're doing with a strategic, you wonder whether, I know my leadership team had some angst as we went through this process. What is that going to do to change us? What is that going to do to change our franchisees? Compliance. I mean, we, in personal care, we misspell HIPAA all the time in presentations. We just don't worry about compliance as much as we need to. But obviously, part of a health system, welcome to the world of compliance. So there was some of that cultural, I would say, angst to some extent. But our whole thought process and our cultures, and I mean, Denise had a chance to come and spend a lot of time with our team, we really are aligned. It's just that we had to get around and say, we don't want to look at the future. And private equity is a great resource for lots of folks in this room, and for myself. I'm still a member of a couple of private equity groups. I mean, I think it's an awesome, business model, but they're not going to bring you hospital data. They're not going to bring you relationships. They're not going to bring you abilities for you to. They might provide capital for growth, but they're not going to provide the strategic resources that do the growth that you can do. And I think that's what sold our team and our owners when we looked at the opportunity here and said, there's a great opportunity here that we've never had before. Plus, when you're working with a strategic, they're not looking to sell you in 4 years. So you have a chance to look at more of the long-term strategy of doing it right versus, okay, what's my EBITDA in 3 years because I'm going to have to sell in 4, which was my experience. And that's not a bad thing. It's just that's just how the nature of that is.
Yeah, and I'll just add, in terms of culture, once we had the opportunity to meet the senior helpers team, that it was so evident the passion that they had for the client, which was very consistent with what we have at Advocate Aurora. And so I felt like that was aligned, right away. And then internally, the excitement of having this resource that we didn't have available to us before. So we were working so hard to keep our patients in our network, and then when they needed personal care, they were out the door. And we didn't have that connection anymore. And so the ability, and we're not there yet. We're working on it. But the ability for us to be able to have these seamless transitions like we've been able to do with our other lines of business and continuing health is what we're looking forward to.
Great, thanks. We're starting to run down on time a little bit, so I have a question for each. So what advice, I'll start with Denise, what advice would you give those that are part of a health system, they want to get into the space? What kind of advice how would you help them navigate choosing the right partner and then executing on it?
Yeah, so I feel very fortunate that I have some wonderful peers in the industry, and I think together we have all recognized the importance of having some kind of a relationship in personal care, whether it's owned, it's joint ventured, or it's just a strategic partnership. And particularly given some of the care models that are coming down the path, what happens with choose home or sniff at home, et cetera. So so my advice is just determine what is important to you from that partnership and the structure of the relationship. But I can tell you that the personal care team is very interested in partnerships with home care. It's what they've been looking forward to, and I think the time is now as we start to look at how we manage these populations with longitudinal care plans.
Yeah, I would say a lot of the conversation over the last couple of days has been about how do we team up. We have a workforce challenge, we have policymakers, we have managed care. How can we find ways of I always look at the power of many. How do you find a way to have an opportunity to work together on something that we can be fairly aligned with. So my folks in the room that are looking at these types of partnerships or this acquisition type, be open. I mean, we have to find a way. I think many people said yesterday that, you know, there's fear out there with workforce. There's fear with, you know, out there with policy and managed care and driving rates and negotiating rates and the tail wagging the dog kind of thing. We as an industry have to come together. You know, the 60,000 nurses that apply that get turned down that are qualified to come into college, the industry has to step in and find a way to get those people hired. You can put them right through the entire continuing care continuum of letting them work in personal care, working them in private duty, have them work through that process up and find a way to solve that problem as an industry. Private, you know, companies have solved a lot more faster issues in industry with issues than government does. I don't think we can wait for the government to do those types of things. How do we find ways of making that difference? How do we find ways of disrupting it so we're just not at the altar of all the four payers in the country, and we're actually coming with ammunition that we're here to talk about what we do for our patient, what we do for our client, how we actually make them better, how we keep them at home, because when they go somewhere else, it's a lot more expensive. So we have to be able to go with that, and I think that's what I would, you know, talk about with everybody in the room. Just listen. God gave you 2 ears, 1 mouth. Use them proportionally. Listen to what you're hearing out there. Talk to people about what you're trying to do. I think there's an opportunity here for all of us, not just our acquisition, but all of us to find a way to team together to solve for the client. Healthcare to me, we're out of time, sorry. Due diligence, you know, you look at, you know, healthcare insurance, it's all about compliance. It's not about patient. Let's put the patient first.
Well, thank you. I mean, I'm really excited, and I can't wait next year to find out, you know, a little more than 10 months, but see where you guys have gone, because I think you guys are onto something, and congratulations.